Hello everyone, welcome back to our distant learning program. And today is Monday, which is the first day of our new weeks. And I hope you really enjoy your 2 day break, which is Saturday and Sunday. So you can spend your time with your family and doing your favorite activities. But hey, now it's Monday, so let's move on to our lesson. But I would like to say thank you very much, everyone, for your effort to keep on learning this online class. Because as we already know, online learning is very new to our education system. As a teacher and as a student, it is totally new for the education factor that we implement the online learning. It is very difficult, it is very hard, but as you know, nothing can keep us away from our learning, even though it is a little bit difficult at first. But the more you learn from it, the more you improve, the more you get to know all those technology, it will be a lot easier for you to use this technology in the futures. Imagine when you go to the university, you will use these technologies, you will use this type of online platform for your learning. So take this a chance to improve and to learn to explore all the options of the online class that provided to you. Now everyone, I think it's time for us to look at our lesson today. So as you can see the title on the screen right here, which is making a doctor appointment, and this is the new lesson. It is the unit 4 of our blueprint book. So in this unit 4, the title which is take care of yourself, and we start our lesson, which is the lesson 1. And this lesson is on page 48 of your blueprint books. So in this lesson, everyone, we are talking about the doctor. We are talking about the hospital. So your experience, have you ever been to hospital before? And how was it feel? Okay, so for me, when I was a kid, I was very afraid of going to the hospital. I really hate being in the hospital at that time. Even nowadays, I really don't want to go there. I really scared when I go to the hospital. So hospital is not the place that you can go to enjoy or to entertain, but it's a place when you are sick, when you are unhappy, and you go there. Right, so in today's lesson, we will listen to a conversation and then learn some vocabulary and answer some questions. That's it for our video lesson today. So the conversation is between two people, the receptionist and the patient. So receptionists refer to people who are working on the front desk, who receive the call, who make an appointment for someone else. So we call receptionist. And patient refer to a person who is sick. So we call patients. Now everyone, here is a conversation between a receptionist and a patient who make an appointment to meet the doctor. So everyone pay attention and listen carefully.
Track 23.
Dr. Jackson's office. How can I help you?
Hello, I'd like to make an appointment to see the doctor.
Have you been here before?
Yes, I have.
Okay. What's your name and date of birth?
Samuel Chapman, May 13th, 1990.
And what's the reason for your visit?
I've had a nasty headache since last week. I'm not sure what to do. I've tried different medications, but they haven't helped.
Sounds like the flu. Do you have any other symptoms? Vomiting or trouble breathing?
No, just the pain.
Have you ever experienced a similar headache before?
No, I'm usually very healthy. Could I see the doctor today?
Yes, we've just had a cancellation.
All
Can you
right,
come at
everyone.
3?
So after you finish your listenings, as you can see in the conversations, there are some difficult words that some of you may already know and some of you might not. Now let's learn those vocabulary all together. So we have the word illness, we have the word headache, Okay, medication, vomit, and there are four more. We have trouble breathing, we have the word nasty, flu, and symptom. So let's look at the definitions of all these 8 vocabulary for today's lesson. So the first one is illness. Illness refers to a disease or period of sickness affecting the body or mind. When you have or when you are sick, you have illness. So illness refers to a disease, while sick refer to your condition. Okay, so be able to distinguish between these two words. Sick and illness are totally different. And the other one is headache. So headache refers to a symptom of pain in the face, head, or neck. Some people say headache, you only experience the pains in your head, but actually you can experience the pain in the face, head, or neck as well. The other one is medication, or it is the medicine. It refers to a drug that used to diagnose, cure, treat, or prevent disease. So we call medications. The other one, which is vomit. So as you can see in the picture, vomits refer to the involuntary, which is you have no control over the situation at all, and it is a forceful explosion of the contents of one's stomach through the mouth, and sometimes it can happen through the nose. So it pushes through your stomach, from your stomach through your mouth, which is some food that you take and then it get out of your stomach through your mouth. So we call it vomit. The other one is trouble breathing. So trouble, which is the problem or difficult, the word trouble, and breathing, which means you take the air into your body through your nose. So when it is trouble, which means you find it difficult to take air into your lung. So this is a problem. And the other one, which is nasty. When we talk about people, nasty, which means very, very aggressive. But when we talk about the condition of disease, it is very bad. Let's say nasty headache, which means you have a very, very bad headache. So nasty means very bad or very serious or painful. The other one is flu. So flu, or in the other word we call influenza, which is the full word, and it's an infectious disease. So infectious, which means it can spread from one person to another person. So we call infectious disease. So the most common symptom include high fever. High fever means your body temperature is increasing. Runny nose, which means you have a liquid flow through your nose, and sore throat, which means you get hurt in your throat, which is a tube in your neck, and muscle and joint pains. So joints, which mean some lack, okay, headache, coughing, and feeling tired. So these are the symptoms of flu. So what does symptom mean? The symptom refer to physical actions indicating a condition of disease, particularly such a feature that is apparent to the patient. So if you look back to the word flu, we have the symptom. So symptom is the physical, okay, it's the physical action that indicate a condition of disease. If you have this kind of condition, you are most likely having this kind of disease. So symptom is a signal that can tell you what's wrong with your body, what disease that you are having. So it is very important as well. When you go to meet the doctor will ask you to describe the symptoms. Now everyone, after you listen to that conversation and learn some of those vocabulary, I am sure that some of you might catch up with those words, some of you might not. So make sure you ask your teacher in our online study group. Or if you are not sure, you cannot get any information from your listenings, it is always recommended to open your books and read the conversations, because all this lesson you can find in your books. So let's look at the answer with this four comprehensions question. And these are the four statements. What you need to do is to decide whether it is true or false based on the information from the listenings. Now, everyone, let's look at the first statement. Samuel is Dr. Jackson's patient. So is that true? Actually, it is true. He went to the hospital before. And number two, he haven't taken any medicine yet, which is wrong. Number three, he has several symptoms. Okay, it is correct. Actually, no, only pains. He has headache or only pains around his head. So not several, only one. Number four, he will be able to see the doctor this afternoon. Actually, it is correct. So everyone, after you learn all of this question, I really hope that when you go to see the doctor or when you have a conversation about the doctor appointment, there are some vocabulary that will help you express your idea pretty well. Now, everyone, it seems like our first sessions come to an end, and enjoy a short break. And if you have any questions, take this time to ask your teachers. So everyone, now enjoy your short break, and we will come back to continue our second sessions.